in the next short while, I'm going to give you an overview of heart disease in the world, heart disease and strokes. These ideas are built not by me, but by a large number of people around the world. And the chief architect of this thinking was my mentor, Richard Peto, now Sir Richard Peto. So the first thing is, when you think about heart disease, you'd say, how can we make progress? And then once you accept we can make progress in reducing it, can we really have heart disease in the world? And I'm going to add another word and say having heart disease prematurely, that's before the age of 70, within a generation, so within 30 years. That is huge. So definition of premature changes as you get older, it gets pushed out. So the first thing is to accept that death in old age is inevitable, but death before old age is not. And the other thing is the causes of death in very young children, in sort of youth and young adulthood, that is 5 to 34 years, and in adulthood, that is say 35 to 69 years, are different, but they tend to be similar within each category. And the issues can be harvested in each range, and I'm going to focus largely on the 35 to 69 today. In the world, there are 53 million deaths every year, give or take a few million. Now, of these, 30 million are below the age of 70, and 23 million are over the age of 70. And in those below the age of 70, about 7 million deaths occur between the ages of 0 and 4. Another 5 million occur between 5 and 34. But the large majority, 18 million, occurs between 35 and 70, and that's the focus of my talk today. Sometimes to look forward and to what will happen in the future, you've got to look backwards. And let us look at the mortality rates in a country like England that kept very good statistics for a long time. So I'm going to show you data in 1910, 1960, and 2010, and look at the risks at the age of 5 and at the age of 70. So these are the survival curves, and you will see that at the bottom end here is what happened in 1910. You will see that by the age of 10, about 20% of children were dead. Compare that by 1960, where it was under 5%, and by 2010, it's under 1%. These are huge changes within 100 years. Let's take the age of 50, and you will see in 1910, about 50% of the people who were born were dead by the age of 50. Compare that in 1970, where still 90% were alive, and by 2010, about 95% were alive. And if you look at 70, you will see that even at the age of 70, there are many more people who are alive in 2010 compared to 1910. And soon we will have we'll have a lot of people living beyond 100. So the last 100 years has seen the biggest advance in human health compared to the history of mankind ever. And this has been a tremendous 100 years. Now, let us look at what the main reasons were. So what is given in shaded are deaths from tobacco. What's on the white is the added number from non-tobacco deaths. And you will see from 1960 in men to 2010 right now, you will see there's a marked decline from 19 per 1,000 deaths down to 4 per 1,000 over that period of time, a 75% reduction in that short period of time. And if you look at the rest, you will see there is a decline, but nowhere near there. This has two messages. The biggest killer that mankind has known ever in the history is tobacco, more than the plague, more than wars, more than anything else. The second thing is that you can actually make big changes in relatively short times. For instance, 50 years as a fraction of human health is tiny. 50 years as a proportion of the number of years people have been in the world. So you can actually make big changes in a short time. Now, coming back to those same numbers, of the 53 million, this is just to remind you, 0 to 4, 7 million, 5 to 34, 5 million, and 35 to 70, 18 million. And I'm not going to focus on the 70 plus million. Now, if you look at this worldwide, because I showed you numbers for England, if you look at it worldwide, we are seeing a parallel decline. 1950, 25% was the childhood mortality. By 2010, it was 5%. This is huge to see that worldwide. This happened both in the rich countries and in the poor countries, and this happened in the countries with a lot of technology and those with relatively little technology. So this is telling you that social changes and some aspects of healthcare, like a midwife going and attending a birth, is what made a difference, as opposed to high-tech care. Now, this one is looking at the world mortality by the different age groups. So when you look at this, what you're seeing is down here, the earlier period, 1970 down here, this is 2010, and you will see in the age group 0 to 4 in the world as a whole, that is the left panel, there's a decline. 5 to 49, a decline. 0 to 49, that is these two put together, a decline. And 50 to 70, a decline. You're seeing that in the low-income countries, you're seeing that in the high-income countries, and you're seeing that in the low middle and the upper middle. If you take the world as a whole, you have 20% of the world is high-income countries, 20% is low-income countries, 60% are middle-income countries, with half being high-middle and half being low-middle. That's an easy way to remember. Now, one way to look at what's happening is to take the 25 most populous countries in the world that constitute 75% of the global population, and Canada doesn't count. So this doesn't include Canada, but includes the United States and the UK and other countries where the trends are identical, and we look at the mortality in these three age groups. The first thing to do is to look at mortality 0 to 4, and you'll see in practically every country there's a decline. So what you're seeing on the top is the earliest period, which is 1970, and then 40 years later, 2010. And this blob there, like the head of a sperm, is the most recent. And in every case, the head of the sperm is swimming downwards, going south. And you'll see that every country. You'll see that in the rich countries at the far right end, which started low but kept on going lower. And the poor countries at the left end, like the Democratic Republic of Congo, that started high and still remains high. So that's good news. So whatever we did globally helped everybody. Now, this is between the ages of 5 and 49, generally the same pattern, except for a few differences. You will see in countries like South Africa on the left, it actually went up, and this is the HIV epidemic. You will see countries like Iran. Where is Iran? Somewhere there. Iran, when they had the war with Iraq, several million people died. So then war can interfere with it. Or you can look at countries like Russia, which is down here. You'll see it actually went up. And that is social upheaval after the fall of the Soviet Union. And during Yeltsin's time, there was massive chaos. And then alcoholism increased, deaths from violence increased. So barring those two or three exceptions, in every country it went down. And some of these arrows are over India, and some of them are over China, to show you that even the poor countries changed. Now, this is 50 to 69. Again, the same pattern. You will see India, it came down. Ethiopia, one of the big countries in Africa, came down. I think that's China, and this is the US. So rich and poor countries in different continents came down. And what you're seeing out here is that, again, this is Russia. You'll see alcoholism, violence, and social upheaval was destructive. So this is bringing me to my second point. The determinants of health are the big dial issues in society. It's not necessarily medical care. In Western countries where social circumstances are more or less stable, medical care plays a much bigger role. In the poorer countries where social factors dominate, social factors play a bigger role. Now, worldwide, there are only 4 or 5 causes that are the big causes of premature deaths. The first is tobacco, which I talked about, HIV, an epidemic like HIV, or if an epidemic like Ebola spread worldwide, that would be a disaster. Alcohol, adiposity, and war. And these are the only things that have fluctuated between populations over time. So let me give you an example of the UK, and these are male mortality, the top line, and the bottom is female mortality. The X is the time I finished my PhD. It had nothing to do with the decline. It's just that that's a way of me remembering. And you will see this massive decrease where it was about, about 20% or so. I can't read it from 25% of the deaths in males down to about 5% in that 30, 40 years. That's huge, 75% reduction. You'll see women as well showed that decline. However, not all countries showed this. This is Hungary, that showed initially an increase in men and then a decline. And this is to do again with the fall of the Soviet Empire, that the initial reaction was chaos. Whenever a regime is overthrown, you're going to get chaos. It happened in England after the Civil War. It happened in France. It happened in Russia. It's happening right now in the Middle East. So you've got to anticipate, once you have regime change, it's chaos for a few decades. And then it starts to stabilize. And you could see in women, it was fairly stable, and then both in men and women, it declined. This is Russia, showing you the erratic nature, especially in men, less so in women, but there was no improvement in women till more recent times. So the question is, can we have vascular mortality? And the first thing is, if you had a heart attack or a stroke, we have enough treatments today that collectively put together can reduce the risk of another heart attack by 50% to 70%. And what you do is you get people to stop smoking, give them aspirin, cholesterol lowering, and a blood pressure lowering drug, and you can reduce it by 70%. Now, there are new medications that combines everything except the smoking part of it. And you can make big impacts. And there's no reason, today it's available at about 25 cents a day. There's no reason in future it can't be available at 5 cents a day. So imagine having a medication at 5 cents a day in high-risk people, reducing mortality by 50 to 60%, and then on top of that, if you get people to stop smoking, you add it to 75%. That is huge, isn't it? Now, that's the same thing. Now, I want to show you a slide on how bad tobacco is, and how bad tobacco is in women. And the reason I focus on women is today in Canada, young women are more often smokers than men. Men have declined. Historically, women were more sensible than men. Today, it's reversed. So what this is showing you is, this is a study where they took 1 million women in the UK and then asked them, do you smoke? How much do you smoke? When did you quit? And you will see, even as little as 10 cigarettes a day doubles the risk of death. 15 triples, and 20 quadruples. So if any of you know people who smoke, just the biggest favor you can do for them is to persuade them to stop smoking. And the other thing about this is, not only is the risk great for people who smoke, but if you get people to stop smoking before the age of 40, you can virtually eliminate the risk of smoking. So the perfect way to smoke is start to smoke when you're born, and keep on smoking till you become 39 years, and then stop, plop. And then you live forever. So these are the data that shows us. So this is people stopping smoking at the age of 20. And this is the risk, that is threefold risk in the people who continue to smoke and for the next 20 years. So if they stopped at the age of 20, and seriously, they may have smoked for 5 years, the risk is not increased. If they smoke around 30 years, you'll see the risk is only increased by 5%. It's not huge. If they stopped at the age of 40, the risk is only 1.2-fold compared to 300% in somebody who continued to smoke. So, and obviously if they stopped at 50, you still avoid most of the deaths due to smoking. So stopping smoking at any age is very important, but stopping smoking before the age of 30 or 40, it will nearly eliminate most of the risk of smoking. The other thing is elevated blood pressure. If your blood pressure is higher than by about 10 millimeters, now most of you know that the average blood pressure in a population is around 125 to 130 or so. That is systolic, the upper number, okay? Now, if it is lowered in people with high blood pressure by 10 millimeters, and you can do that today easily by 1 or 2 low doses of 1 or 2 blood pressure lowering drugs, which together needn't be more than 10 or 15 cents a day, you can reduce the risk by 1/4. That's big. And cholesterol is the other big cause of heart disease and strokes. And if you give a drug called a statin that impairs the production of the bad cholesterol, LDL cholesterol, or what's called the low density lipoprotein cholesterol. All of you know there's good cholesterol and bad cholesterol. This is the bad cholesterol. If you can reduce it by 2 millimoles, that is by about 1/3, you'll reduce the risk by 40%. So smoking, big effect, blood pressure, big effect, cholesterol lowering, big effect, and if you put it all together, you'll have big effects. Now, one of the things about smoking I've heard people say is we've beaten tobacco. There's nothing more incorrect than that. In the last century, that's down at the bottom in yellow, 100 million people died from tobacco. In this century, if the current rates of tobacco smoking continues, 1 billion people will die. And the reason is in the last century, the rates of smoking increased till the 1950s and 60s, especially in women it was later. And second, it was confined largely to Western countries. In this century, we have exported the epidemic of tobacco to China, to India, which are much more populous than Canada, the US, or the UK. And remember, this is smoking through the whole century. And in the next 20 years, that's the top line, 2000 to 2019, 100 million will die. Those 100 million are current smokers. So advising children to stop smoking won't touch those 100 million deaths. The next 30 years, 2020 to 2050, 250 million will die. Half of them are current smokers, half of them will be new smokers. And obviously from 2050 to 2100, there will be 500 million deaths, and all of them will be new smokers. So the best way to have an impact in the next 30 years is to get people to quit. And if you get them to quit, their children will not start smoking. Right now, our public health strategy is emphasizing childhood cessation over quitting programs. Like in Hamilton, there's practically no quitting program for tobacco control. So this is the kind of thing we need. Now, one of the biggest things you can do to control tobacco is a policy. And the policy is to have laws that reduce the use of tobacco. And of those, the most important one is increasing the prices. In the UK, they had 2 big price increases, one in 1947 and one in 1981. And during that time, immediately the rates of tobacco smoking came down. Now remember, governments make a ton of money from the taxes on tobacco. And one of the reasons they are reluctant to increase the price of tobacco too much is because they are concerned what will happen to their revenues. So in South Africa and France, the experiences suggest if you triple the price of cigarettes, smoking rates will halve. But despite halving it, government revenues will still be doubled. So now this can't obviously go on indefinitely, because at some stage the numbers of people smoking will be very low. So I'll stop here by reminding you there are really 5 main causes worldwide of premature death. These are tobacco, HIV, which I didn't talk about, it has nothing to do with heart disease, alcohol, adiposity, that is obesity, and war. And of this, alcohol, tobacco, and adiposity, that is obesity, affects heart disease. So remember, death in old age is inevitable, but death before old age is not. Thank you.